Thank you, Madam Deputy Speaker.
The motion be agreed to, sorry.
The motion be agreed to. Thank you. Thank you, Madam Deputy Speaker. I rise to thank the member for Macarthur for moving this motion and providing me with this opportunity to speak on this very important issue. A child's health and cognitive and social development begins at preconception with the help of parents during pregnancy, affecting the health of the baby at birth and through their early years and well into our adulthood. That's a known fact. The Morrison government recognises this in their National Action Plan for the Health of Children and Young People 2020 to 2030. This plan aims to ensure that Australian children and young people from all backgrounds and all walks of life have the same opportunities to fulfil their health potential and are healthy, safe and thriving. The roadmap will guide collaborative approaches to improving health outcomes for all children and young people, particularly those at greatest risk of poor health. This includes programs to empower parents and caregivers to maximise healthy development, from mental health to addressing chronic conditions, and particularly preventive health, which is a particular passion of mine. And like the member for Macarthur, as a paediatrician, we have prevention in our DNA. Madam Deputy Speaker, we know that there are many factors that are needed to be considered for a comprehensive, effective system of care for children. The consultation draft of Australia's Primary Healthcare 10-year Plan 2022 to 2032 highlights the importance of a reform through primary care to support pregnant women and young families to improve health in the first 2,000 days of life. I welcome the implementation of the former COAG Health Council's 2019 strategy for Australian maternity services. From this comes targeted programs and initiatives that provide access to information, guidance and support for women, partners and their families, as well as for healthcare professionals to provide care to pregnant women, providing evidence-based and education initiatives. Importantly, I'm proud the government is also investing in the health and wellbeing of Aboriginal and Torres Strait Islander children and their families. Through activities that seek to improve health outcomes during pregnancy and the early years, the programs focus on mothers, babies and children of greatest need in rural, remote and very remote communities around Australia. These are difficult issues, however, Madam Deputy Speaker, and having worked up there 30 years ago, I know that it's very difficult to make strides to close the gap for the health of our Indigenous friends. Madam Deputy Speaker, building on this strategic approach, it's very important particularly to look at children's mental health and wellbeing. And I'm very proud that government has launched the National Children's Mental Health and Wellbeing Strategy. This is recognised as a world first, as this is the first time a national government has developed a strategy that considers mental health and wellbeing outcomes for children from birth to 12 years of age, as well as their families and the communities who nurture them. Chairs of the report, Professor Frank Oberclade, AM, and Professor Crystal Mindledorp, say this in their foreword to the National Children's Mental Health and Wellbeing Strategy report. We were interested in looking broadly at the system as a whole, from parent mental health literacy and reducing stigma through to the management of complex problems in expert settings and everything in between. Given the complexity of the current system, we did not want to simply argue for new services to be added. Rather, we aim to develop a roadmap to effectively restructure and improve what was already in place and to support the many thousands of committed professionals working in this area. It's about getting people to work better together, not in silos. We are aware that a major restructure is more difficult than adding new services, but are convinced this is the best way forward. Madam Deputy Speaker, as a former paediatrician and colleague of Professor Frank Oberclade, one of the co-chairs, I'm proud this government has a commitment to fund the strategy. This funding includes $317 million and includes $54 million to work in partnership with states and territories to create a network of Head to Health Kids mental health, which is based on the Headspace mental health, which is highly effective and has been rolled out for young adults. It also will have these Head to Health Kids mental health and wellbeing hubs are specifically for children aged 0 to 12 years, as we recognise the increase of anxiety, depression, ADHD and other mental health issues in that age group. There is $42 million to support access to parenting education and support, and $47 million for perinatal mental health initiatives to support the mental health and wellbeing of new and expectant parents, including funding for the Perinatal Anxiety and Depression Australia group, which is a very important group called PANDA, which supports mums and dads in those early, very difficult and anxiety-provoking early weeks and days and months. The Morrison government understands that the future success of our country depends on the next generation. Thank you, Madam Deputy Speaker.
Thank you. And the question is that motion be agreed to.